We had a community-led HIV/AIDS initiative, which in abbreviation we refer to it as CHAI. One of these CHAI communities that we have seen over time is the Kasilo community-based healthcare program. This community started as a result of 9 people, and these 9 people were people living with HIV/AIDS. Now, this CHAI eventually has managed to grow, and growing with this vast kind of activity. Given the fact that these communities were trained on how to self-manage, how to manage their projects, we found out that Kasilo community-based healthcare program was able to use the skills which were given in order to apply for other grants. And all these grants amount to about 200 million over this short period of time.
The fact that we developed their capacity to have this in place and to make sure that they are capable of handling even bigger monies than ours is an innovation, because it is the same civil society organizations, faith-based organizations, organizations of people living with HIV/AIDS who are now implementing big monies from the Global Fund and from PEPFAR.
And in that respect, the map was a precursor. It was also a precursor because of its specific objective of supporting civil society, which we know is a key component of the response against HIV/AIDS.
Every time I went to Africa, I made sure that I spent a day visiting with people who were in the front lines, in the communities, in the villages. It was very important to reach these people, to build awareness in them, and to take preventive action.
MASA was founded in 1992 by a few volunteers. World Bank assisted us by sponsoring or funding the PMTCT project, that's the prevention of mother-to-child transmission of HIV/AIDS. And we have some mothers, even some children, who have been born of parents with HIV/AIDS, but they are HIV-free. Through that effort, the World Bank effort, we have a success.
I gave birth to this kid. He's now 7 months. She was negative. Taking these drugs, 3TC, D40, and Univerapine. These are some of the drugs that I'm taking. I'm living positively. I am able to work. I can sing and dance, and I'm feeding my baby.
Acha kwanza usimnyonyeshe, kaekae kidogo ili labda anaweza tapika.
In many of the MAP countries, the first thing we did was to embark on building counseling and testing facilities. This is way before the universal access to treatment. In the first 2 MAP countries, the counseling and testing centers had increased by over 200%.
World Bank trained some counselors for this place. We were only 2 trained counselors, but World Bank assisted, and we trained 20 HIV/AIDS counselors. We just give in our budget, and it's approved by the district. Once it has been approved, funds normally come from the district to the grassroots.
In most of the countries in Africa, the health systems has been neglected for years, way before the HIV/AIDS epidemic. The only thing HIV/AIDS did was to bring it to the forefront, to show us how the world had neglected health systems in Africa. The health sector was losing its staff. Doctors were dying, nurses were dying. So all these things were compounded on a health system which was in very bad shape to begin with before HIV/AIDS. Over 30% of the MAP's resources have gone directly into supporting health systems, strengthening health systems, building capacity.
MAP helps us. Through home-based care, they have trained many people, and those people who are trained, they also go in the community and train others. And those people are supposed to go and follow up other 5 people for each person who has been trained. And so far we have 300 people.
I've been living with HIV/AIDS since the 80s. Naza kubagira mba narapfuye.
Nanjye banteyemo akanyabugabo. Mbonye bakora neza nanjye mba umukora gushatse.
Usura ingo zingahe? Usura abantu ngabangahe?
Yesu isura ingo ngundi sinzwe ingo eshanu.
MAP is the first grant with a national impact in Rwanda. MAP help a lot. 1/3 of the funds go directly to the health system. We strengthen the health system and we make it available to the community so that those vulnerable HIV positive people can benefit. But it's not only HIV people who benefit, it's all the population surrounding. So teaching the health workers, teaching the lab technicians, train antenatal clinic, nutritional clinic, reinforce health system, providing equipment and infrastructure. All this make the health services more available in the population. I think by doing the MAP, the bank showed its human face.
It's the faces of the women that I saw every time I went to Africa as VP, who were either HIV positive or worrying about their kids who were affected. So it's that human dimension that drives me.
I would like to say thank you for what you have done for our people.
We shall reach further. We shall expand further, and we shall reach many more people.
For the first time, participatory planning actually works.
Country ownership is one of the most important things any of us can do. It's a hallmark and benchmark of good development programs.
I'll be the last person to say the MAP was perfect. That's why we call it learning by doing. We are still learning. However, the MAP was the first initiative that got to Africa, and that made a difference in changing the course of this epidemic.
It's true that there are many players in the fight against AIDS in the world, but there are only a few big players. The bank is one of them.
The MAP initiative, we see its success in the Global Fund, in PEPFAR, and in the many contributions that the HIV/AIDS epidemic is attracting. And that keeps us going.
That link between fighting a disease and promoting health as an element of development is where the World Bank brings its specific skills and added value.
We were there when the epidemic was at its peak. We were there when there was very little hope. And we continue to be there